Now, workers' union Nehawu is set to outline its way forward following a week of demonstrations. Many state-owned institutions were negatively impacted by the strike last week, resulting in disruptions to services, especially at hospitals throughout the country. Workers are demanding a 10% wage hike, while government has not wavered on its 3% offer. To tell us more, let's get you the latest with our reporter Katleho Sekhotho, who joins us at that venue where the briefing will be taking place in Braamfontein this morning. Katleho, it's great to see you, and I'm sure many people across the country who were impacted when they were trying to access healthcare services impacted by the strike will want to know what the way forward is, especially because there is an interdict that is in place.
Yes. A very good morning, Michelle. We are here at the Parktonian Hotel in Braamfontein, where Nehawu is set to give that briefing in about 2 hours' time. And they're really going to outline the way forward as a union. Since this week protest, we saw the protest really reach, crisis mode where hospitals, particularly in Gauteng, Charlotte Maxeke, as well as Helen Joseph, seeing demonstrations outside the hospitals. And we saw the chaos that erupted there when tires were being burned, especially at Helen Joseph, and on a particular day, patients being prevented from going in. But before I get to that, there is the court case, the matter at the Labour Court regarding the Public Service and Administration Department getting that interdict to prevent the strike from continuing, but then Nehawu appealing that interdict. So on Friday last week, judgment was reserved in the matter to tomorrow, that is Monday. So before then, Nehawu is saying that they will give this briefing to outline what their intentions are for the week pending this judgment that we should be hearing tomorrow. But to get back onto what the strike has been looking like, we saw earlier on in the week Health Minister Joe Phaahla giving a briefing at Charlotte Maxeke alongside the CEO of the hospital, as well as police, as well as the MEC for Health in Gauteng, really outlining some of the effects that the strike has had on the health sector, specifically at hospitals. And the minister outlining that according to preliminary reports that they had seen, 4 people had died as a result of the strike. So what essentially is happening with the strike is that as much as it's administrative staff and clerks who are on strike, they, being able to go on strike because doctors and nurses not being able to strike because they are essential services. The minister, alongside the CEO of the hospital, outlining that as much as doctors and nurses can be at the facilities, if they don't have clerks and admin staff to be there, they can't continue with their work as per usual. So you saw really a lot of skeleton staff at many of the hospitals. So it will be interesting to hear what the unions will be saying today. They have said this morning that they've already received requests from a number of unions that are looking to join them in their strike. This is SAPU, NUPSA, and Pop Crew as well, I understand. So we'll hear from the union today whether they will be continuing with the strike and what happens if things go in their favor or not in their favor when judgment is handed down tomorrow.
So, Kat, can you give us some clarity on the numbers at play here? So workers are demanding that 10% salary hike, right, along with the 2,500 Rand housing subsidy. What is the offer on the table now? Because there's the 3% figure and then there's the 4.7% figure.
Right. So government has not really budged on its 3% hike. And as we saw from the 3% offer, and as we saw from the budget speech outlined earlier, last month by Minister Enoch Godongwana, really saying that they cannot bloat the wage bill even further than it is already. So it really is a push and pull between the unions as well as the government. And, you know, unions saying things have turned sour, government also saying things have turned sour, and both parties pointing fingers at each other that negotiations are happening in bad faith due to the other party. So it is a stalemate at the moment.
We also understand that decision around the interdict will be made tomorrow morning. I suppose that's one of the big questions we'll want to hear from Nehawu today is, outside of that decision, do workers go to the picket line as of tomorrow morning, or do they wait for that decision?
You know, from the way it sounds right now, Nehawu is prepared to go ahead until the judgment. And, you know, it seems as if even with that judgment, there might be another appeal. So, you know, really adamant about carrying on with the strike, Nehawu seems to be, as well as these other unions who are now joining Nehawu, saying we will stand in solidarity with the unions in carrying out the strike. But I mean, one of the biggest things as well is Nehawu, you know, when we saw earlier on the strike beginning, and I think it was about Tuesday or Wednesday, things became quite chaotic at the hospitals especially. The CEO of Charlotte Maxeke, Gladys Bohoshi, saying they didn't have ambulances being able to come onto facilities. They weren't able to have doctors working. There were units where staff, other general staff, had to chip in to care for patients. ICU was critical, you know, the CEO outlining that out of 33 surgeries or theaters that they have, only 2 were operating. So the effects of the strike, specifically on the healthcare sector, has been the most detrimental or highlighted as one of the areas that have been worrying. And so it will be interesting to see, because later on in the week, we did see some Nehawu workers really pulling back from escalating situations because patients were then able to go into facilities and be able to attended to by doctors and nurses, although inside the hospitals there were still skeleton staff. So there has been sort of a de-escalation of the strike in terms of the violence and some of the chaos happening at the facilities. But definitely it seems that they intend to carry on, although we'll hear those details in this briefing.
Katleho Sekhotho, let me thank you for your time this morning. That briefing by Nehawu is set to get underway around 12 o'clock. And of course, Katleho will keep us up to speed with what the union has to say. The Health and Allied Workers Indaba Trade Union also speaking to us just this morning on the channel, saying that they'll also be joining the strike action.